Hello and welcome to my fifth video about how our foods and beverages cause or worsen many common diseases. I am Dr. William Emmett Walsh, the author of How I Recovered from Dementia, my seventh book about diet-caused disease. In my previous videos, I pointed out how the aging chemicals in foods and beverages cause so many of the diseases we suffer. I named them the aging chemicals because the damage they do to our bodies and mind when we consume them in excessive amounts age us. We would look much younger and feel much younger if we had avoided these excesses. Today I'll tell you why these diseases affect us. I will emphasize the dementias as I have dementia and am recovering from it. Much of what I tell you is a review of what I have already discussed. By reviewing these diseases and their causes, I hope to give you a better realization of why they make us sick and how to recover from them. I will start by commenting on a question: what diseases spring from our diet? You already know the answer to that by my previous videos. The answer is every disease of our body and mind is worsened by our diet. When they are consumed in excess, the aging chemicals are whole body poisons. Not strong poisons like cyanide or arsenic. They are weak poisons, but harmful because we eat them daily as part of our diet. Their harm is worsened because they all act together. Imagine the damage a poor baby nerve cell suffers from the bloodstream disruption from fructose, the overstimulation from MSG, the acid-base changes of the citrus acids, and the aging induced by galactose, all operating together on one of the most sensitive baby cells of the human body. That cell is the immature nerve cell. No wonder that this cell cannot reach the brain to keep it from becoming too old to keep us alive. This daily poisoning, magnified by years of consumption, promotes all diseases. The poisoned body is a diseased body. We have thousands of genes that determine us and how we respond to events. Some of these genes make us susceptible to body illnesses like cancer, heart disease, strokes, dementia, and macular degeneration, or to mental conditions like depression and anxiety. Then, a lifetime of eating foods flavored by excess consumption of fructose, galactose, MSG, or the citrus acids will promote these diseases. If we do not consume these excesses, it is likely that we would never suffer these diseases. An example of these genes is the gene APOE4 that makes us susceptible to Alzheimer's disease. It does so by hastening the breakdown of the barrier that protects the brain from the poisons circulating in the bloodstream. With this breakdown, the aging chemicals can reach and damage the brain. If we are not consuming these chemicals in excess, the breakdown in the blood-brain barrier would probably occur, but not bring on Alzheimer's or Parkinson's or other dementias. Another question: at what age does dementia start? How about this answer? At a very early age. Researchers in Spain, Finland, and England attempted to find this answer and found evidence that children who followed the Mediterranean diet enjoyed better health and higher IQs. This diet avoids, the Mediterranean diet avoids fructose and partially discourages using MSG. I believe this avoidance delays the onset of diseases such as dementia. Therefore, even in childhood and the teen years, avoiding some of these aging chemicals improves overall health and brain power. Poor health and poor brain activity are hallmarks of dementia, or stated differently. Even in childhood, dementia stalks the young. The implications of this thought are profound. For instance, how would you feed a child who will be taking a test? Is the answer carefully follow the dementia diet plan for 1 to 2 weeks pre-test? For an older child or adult, what should they eat before a test for college or graduate school, or when interviewing for a highly sought-after job? Is it the same answer as for the younger test taker, a cautious diet? A last question, is the diet the difference between a person who succeeds and one who fails? I believe the answer to all of these questions is in the diet. So what do we know about diet-caused diseases, such as dementias? First, that dementia is only one of many diseases caused by the diet. Second, that there is good evidence that the conditions necessary for dementia and stroke, heart disease, and all the other diseases that we are subject to are present, although muted in childhood, persistent through the teens and early adulthood, and as we age, fully expressed as diseases. Yes, I believe that this is so. I also believe that people that avoid eating excess aging chemicals have a competitive advantage in tests, goal seeking, and in pursuit of our other aspirations, including the prevention of the diseases of the aged. Next question, why do older people suffer more than children, adolescents, and early adults from the diet-caused diseases? I suspect that the reason for this age-related disease susceptibility is damage to the brain's blood-brain barrier. This barrier protects the brain from many poisons in the foods and beverages that we consume daily. It coats the blood vessels that supply the brain to keep these chemicals out of the brain. The poisons from food and beverages float in the bloodstream, and this barrier hinders their entrance. But as we age, this barrier deteriorates. Blood-brain barrier damage lets troubling chemicals like the aging food chemicals into the brain where they cause damage. The immune system can react against this damage, setting off an immune reaction that attacks the brain and the blood-brain barrier. This further damaged blood-brain barrier allows other chemicals to pass through and injure the brain. But blood-brain barrier damage occurs with sports injuries with concussion, from striking the head while falling on ice, from unnoticed microinfarcts, and from infection. Many of us have indolent herpes virus infection of the brain. Each injury to the brain may end with a persistent scar of the blood-brain barrier that allows the entrance of poisonous chemicals. These leaks in the barrier accumulate with age. They are the consequences of an active life. They may allow brain exposure to the excessive fructose, galactose, MSG, and citrus acid in our diets. Thus arises dementia. Let's return to our list of what makes diseases like dementia. First, our diet causes or worsens many diseases, including dementia. Second, excess fructose, galactose, MSG, and citrus acid cause these diseases. Third, symptoms of these diet-caused diseases are present but unnoticed in childhood, quiet through the teens and older children, and apparent as we age. Fourth, careful avoidance of these diet excesses may prevent the diseases I already mentioned from striking as we age. Fifth, a low concentration of fructose, MSG, galactose, citrus acid diet gives a competitive advantage to all of our endeavors. I'm a patient treating medical doctor. If you came to my office for diagnosis and treatment, this information I would give you in my clinic is the same information I gave you in this video. I will tell you about how to follow my diet in future videos. My next video, the sixth video, I believe will shock you. Please come back for it. Thank you for being with me today.